A 65-year-old male patient presents for evaluation of dizziness and progressive lower extremity edema. You are his treating physician. On detailed history, you realize that he previously had hypertension, well controlled on medicines, but over the last year he started having dizziness and lower blood pressure, so his blood pressure medicines had to be stopped. 1 year ago, he started having frothy urine, and his edema developed around the same time. 3 years ago, he was diagnosed with bilateral carpal tunnel syndrome and had to undergo surgical repair for that. On physical examination, his temperature is 98 degrees Fahrenheit, heart rate is 89 beats per minute, blood pressure is 135/70 while sitting, and 105/50 2 minutes after standing. His respiratory rate is 18 breaths per minute, oxygen saturation is 91% at room air. He is an elderly patient of an average physique, lying comfortably in bed, oriented to time, place, and person. Pupils are equal, round, and bilaterally reactive to light. Conjunctiva is non-injected. There is no jaundice. Oropharynx is clear, but he has poor dentition and multiple missing teeth. He has no cervical, supraclavicular, axillary, or inguinal lymph adenopathy. His abdomen is soft, non-tender, and non-distended. There is 2+ pitting edema up to bilateral thighs. On cardiovascular examination, his JVP is raised. Apex beat is non-displaced. There is no heave or thrill palpable. You auscultate his precordium, and this is the sound you hear. Please listen to the heart sound. On examination of chest, there are no scar mark of previous surgery or visible pulsations, no bony deformity, normal breathing pattern, no bony tenderness, no tactile fremitus. Percussion note is resonant. You auscultate the back of their chest, and this is what you hear. Please listen to his breath sound. CNS examination finds no neurological deficit and is completely unremarkable. A good physician would have 3 to 4 differentials by now. It's like you, as a physician, have formulated a hypothesis, and now you are going to just test your hypothesis to come to a final result. So the investigations you order should be to test that hypothesis. The investigations you order should justify what you are looking for. So this is the patient's ECG. Pause the video for a minute to review it. This is the patient's chest X-ray. Again, pause for a minute to study it. The results of the patient's investigation arrive, and the report is shown here. You can search for the reference ranges and correlate the patient's labs accordingly. The patient undergoes echocardiography, and the important points of his echo report are mentioned here. There is no valvular pathology. He has preserved ejection fraction, bilateral atrial and ventricular thickening, and apical sparing of global longitudinal strain. So what's the most likely diagnosis?